You internalize this conscience that says the more self-sacrifice, the better you are. And you're like, oh, I can do that. And then you're kind of this ideal worker that's disembodied and doesn't have needs and can sustain unsustainable demands because they don't notice what it's doing to them.
This is the Visible Voices podcast. I'm Dr. Resa Lewis, emergency medicine and lifestyle medicine physician, medical educator, and your host. Today's guest is Dr. Rana Awdish, pulmonary and critical care physician at Henry Ford Health. She is the best-selling author of In Shock, and now author of Aftershock, Learning to Re-inhabit My Body After Illness. Aftershock is part memoir, part reckoning, and part love letter. Rana, welcome to the Visible Voices podcast.
Thank you. I'm so happy to be joining you.
Tell us first about In Shock.
In Shock is a book that came out 10 years ago. I wrote it after my own experience of critical illness that happened at the end of my fellowship. I was writing from a perspective of, oh my goodness, there's so much I didn't understand about what it takes to take care of patients from my formal education. And wow, was my patient experience a whole new education. And it felt really important to me that I share what I saw when I was gifted that dual lens of critical care physician and critically ill patient.
It's 10 years later. Aftershock begins not exactly, but mostly on a stage. Houston. Take us to that stage in Houston.
Yeah, I was giving an inspiring keynote address to a medical group there. I'd done it a bunch of times. It was in a phase of my life where I was asked to give a lot of talks about the lessons of In Shock. And as I was delivering it, I tend to use a lot of art in my presentations. And I was showing a picture of Christina's world. And I was describing how Andrew Wyeth had painted this beautiful, iconic image of this woman dragging herself across the field. But all the substitutions and erasures he'd made, how he didn't use Christina's disabled body, but instead used his slender, younger wife's body. And how it wasn't really Christina's world we were looking at. It was inspiration porn. It was Wyeth's world. And suddenly I was like, oh, you know who else did that? I did that. I use neat and prescriptive narrative choices so that I could take credit for the beauty and subtract all of the hard things. Okay. And it sort of spiraled from there, where the rest of the talk, I felt like I was addressing myself and just disclosing layer after layer of my own self-erasure. And I came away from it just feeling like I don't actually know the things I thought I knew, and I have to start over.
You already referenced something that I had taken note of, was this mind, body, spirit, that you really believed you were good, you had healed. And then you're like, actually, mind, body, spirit. And in fact, those are 3 sections of the book.
So I'm not someone who has the ability to outline a book ahead of time. I envy people who can do that, who have a clear vision and know what they're writing towards. My writing's really always been about discovery, and it makes for some pretty terrible first drafts. But it gets me somewhere that interests me, and that really is propulsive for me as a writer. And I found in the last sort of set of edits that the book had kind of organized into these sections that I was intrigued by. There's the cognitive for the first section. Then there's trying to go a little bit more into my body and trying to adopt these practices that it would allow me to be in conversation with it. And then there's more reckoning with death, the spiritual realms. It felt really important to me at that time to get those thoughts on the page, especially for my young son, because I really felt like I was dying and I wanted him to have a representation of what I believed. And it's a lot easier to do that with words on a page than it is in daily conversation with a preteen boy. And then the return, because the whole healing journey for me was really just this spiral of circling closer towards myself. It really felt like just making pass after pass with new tools.
Art, the role that art has played in your life, and specifically painting. I get a lot of visions of Frida Kahlo.
No, I identify in many ways. I picked up painting when I was bedbound. I'd never painted before, but I'd had a stroke in the OR. I couldn't really see clearly. I was never a big TV person, but I couldn't read, which was my life sustainment. And I was just alone in bed, and everyone had kind of gone back to their lives. And I needed to figure out a way to pass 8 hours when a minute ago I'd been a busy ICU physician. And so I ordered some supplies online and I started to paint, and it was really helpful because the shock that I had, the lack of blood flow to my brain, had really deadened me in a cognitive sense. I was unable to express myself. It took a long time for that to come back. And so it was hard for me to express with language what my experience was. To my husband, it was hard for me to explain why my nightmares were so scary when I knew they weren't real. And I was a big grown-up girl and I was dreaming I was drowning because of all the fluid in my lungs. And it felt so real because it was reflective of my embodied experience of nearly drowning from the fluid. And that ability to translate with imagery was a lifeline for me.
It reminds me a bit of children that don't yet have words or traumatic things have happened. Art therapy. I wrote that there are 5 bodies in this book, 5 embodiments. You, your husband, Randy, your son, Walt, your dear friend, Tiffany, and your body. There are other people. You mentioned your mom, you have an aunt, you have a brother.
So Tiffany was a friend of mine who had been born with cystic fibrosis, and she had undergone 2 double lung transplants. And we met at an event in Connecticut and just became instant friends. And it got to the point that we gave talks together and would collaborate and have, shared idea sessions. And she could not understand my obsession with compassionate communication. She just thought empathy was added fluff. And I'd built my life on this thing that believed more than anything that medicine had to be more compassionate. And she just wanted teams that knew what they were doing and respected her and looked at her as a capable whole human and regarded her body with a sense of awe. And she couldn't find that. And it took me a while to realize that, to her, people who delivered sort of imprecise empathic statements, that came off a lot like pity to her. And she didn't feel like someone who should be pitied. She felt incredibly strong. And she felt like if medicine could see sick bodies the way she viewed her own sick body, that we wouldn't have to learn to talk different, that we would just be different. And that was like a revelation to me. She died of kidney failure in 2023. And part of this book was really honoring what she had taught me. I think any doctor will tell you they learn more from their patients than they learn from anyone else. And her patient voice just lives in my heart. My husband, who many people feel was the hero of In Shock, survived 2 years of me writing this book where I told him every day, you are not the hero of book 2, because he is not the hero of book 2. The healing that I needed to find wasn't something he could help me with or even be by my side for. It was really my own introspective, exploration. I still like him. It's fine, but he is not the hero. And then Walt is my son, who at the beginning of the book is very young and by the end is kind of a preteen teen. And so much of what I write about my experience with him in the book is just this unbelievable sort of wisdom that children have that is based on pure observation and curiosity and just openness, like a porousness with the world where they're just like vibing with it and like telling you their experiences it. And it was such a counterfoil to my medical cognitive knowledge that it just kept coming up as a truth to me, these things that he would say. And then my body, it's the thing I was trying to find my way back to. I did not start it attached. I was on stage completely detached from it and just wishing it would disappear and I could just go around like a floating orb of light that didn't have pain and debility. And in the end, I think I found a way back.
Tiffany was there. She played a role in that aha moment, that big
Yeah.
day of you on stage in Houston.
Yeah, it was one of those God moments of like, I went to the airport, I was pissed off, I just wanted to get home. Everything was stupid. I was stupid. And I thought I was like hallucinating her just because she's the person I would have wanted to talk to. And it turns out she was there at the airport and we had about 6 minutes together between our flights where I tried to tell her what had happened. And she was just like, oh, you poor thing. You think you have to have it all figured out? Like, it's okay to have doubt. Like, doubt is the way forward. And I was like, no, it's dumb. I hate it. But she was right. Doubt was the way forward.
In terms of now, in terms of how you feel on a daily basis, are you living with pain? What sort of disability do you have? You mentioned also having a stroke.
That residual deficit of just the visual changes, it comes up for me, especially when I try to go downstairs. I just have difficulty with convergence in my vision because of the location. I've adapted to what at the beginning was a very strong pull to the left. My balance was really difficult. When I started writing this book, I was still having quite a lot of pain. I was on immunosuppressant medications for autoimmune disease. I was, living on Motrin and coffee. I can say now I don't have that, but I do think that through this process of releasing some of the trauma that I had really been carrying and unraveling some of the knots of stored energy through the various embodiment practices, that I've just relaxed some things and I feel healthier than I have in a while.
Tell us about some of those embodiment practices.
The most important to me really has probably been the yin yoga practice. I've been doing yoga since I was 17. I've tried every different kind. When I was in New York, I trained as a yoga instructor. It's always been an important part of my practice, but it's always been the really, really vigorous Ashtanga vinyasa yoga that is not yin. And when I found yin, it was a revelation to me. I stumbled upon this instructor who was a trauma-informed instructor, so she used really generous language like invite and release and relax, and it wasn't prescriptive. And she really guided, and I say us because it's a video. I've never met this person, but she really guides the participants to notice the sensations as they arise without judgment and just trust in your ability to be with them and even soften towards them. And that kind of interoception, that kind of tapping into a bodily sensation and just noticing it without judgment and not having to do something about it, not trying to tamp it down or run away from it or medicate it, was something I'd never known how to do. Tied into that practice is all the wonderful, breath work and meditation and mindfulness. Getting deeper into art was an embodiment practice for me. I attended visual thinking strategy sessions, which is a little more cognitive, but then it became an embodied practice on my own canvas. And I even, tried embodiment through puppetry, and that was helpful to me too.
And stress?
A lot of the embodiment practices that we talked about have been really foundational in my ability to regulate my stress. Medicine's a stressful job. It's impossible to avoid it. If you're avoiding it, you're probably not really engaging with it in any deep way. But even just the process of learning to notice the first evidence of stress building in my body, for me, that's the thing that I notice is I start to get irritated if someone's taking a long time to tell me something. Like, that shouldn't take that long to tell me something. That's a sign that I feel very rushed and pressed for time and stress is building up. And I start to try to dial it back before it builds. Whereas before, I think I would just let the stress accumulate and accumulate and accumulate and not notice the early warning signs until they built. And then I would come home and feel like I needed to have wine to unwind. Instead of like, oh, I'm noticing I'm getting a little irritable. I'm going to go take a little walk, do a little deep breathing. We have quiet rooms in the hospital where they play beautiful imagery and you can just sit there for 5 minutes and stare at it and go back.
You and I resonate on many levels with loving medicine, being called to this profession, which is being a physician, and yet at the same time being able to call out what it rewards. You've noted that suffering and making ourselves inaccessible to ourselves helps us better serve medicine. Training in medicine and then working in an academic institution, that kind of suffering and distancing ourselves from bodily needs, eating, sleeping, calling in sick when sick, that serves us really well.
It serves someone really well. I've started to pay more attention to who my labor is in service of. And it's really interesting that it's often not the patient. Um, you're often in service of some metric or you're in service of some outcome that is not directly related to patient care. And the fact that we were trained to self-sacrifice in that way, it's a brilliant business move. You internalize this conscience that says the more self-sacrifice, the better you are. And you're like, oh, I can do that. And then you're kind of this ideal worker that's disembodied and doesn't have needs and can sustain unsustainable demands because they don't notice what it's doing to them. I don't think that's intentional. I don't think there's some grand wizard that set it up that way, but I think we've accommodated it and we haven't maybe made the movement we could away from it.
3 specific incidents that made me quite angry when I read and then reread. And one was you being accused, language-wise, you've been trying to die on us. She's been trying to die on us all night, distancing, objectifying the patient, talking about someone that's very unstable and is close to death and is in the intensive care unit and, quote, she's trying to die. Being accused, it being written in your chart of being narcotic seeking, plus having an allergic reaction, like feeling your airway close to ertapenem.
3 things that happened. The accusations of being narcotic seeking were probably the most infuriating just because I found myself in a position of being unable to prove something I hadn't done. It was just like, I don't know how to make you believe me. And, I hate to think how many patients have felt that sense of accusation and just immovability. Like whatever the doctor believes is what's true and documented, and it's gaslighting. The allergy that I had started after a procedure where they give you the antibiotics peri-procedure. And I knew I couldn't breathe. I could feel that sensation that I'd had so many times of my lungs just not working. But when they listened to them with the stethoscope, they sounded okay. So again, it was a situation of just trusting their own objective, we would call it, data, against my subjective experience. And I think that's emblematic of medicine. We trust our data, whatever it is, whether it's the CAT scan, what we hear on exam, the labs, over the patient. And that's deeply problematic. And then, that hearing my surgical team say that I was trying to die, that hurt in a different way, because it kind of declared us adversaries. Like, they were on one side trying to save me. I was on the other side fighting them. We weren't on the same side. And they didn't actually believe that I wanted to live. Like, it was such a weird, I didn't know how to try harder not to die. Like, I was doing everything I knew how to do. And so that attribution of intention that was false was another kind of gaslighting, not to overuse the term, but medicine has a ton of it. Yeah, and there were more. It's just sort of a pattern of behavior.
And to flip it 180, there were some real allies. The gastroenterologist that was rounding over the weekend that decided to do a reread and a deep dive into your chart, something that does not often happen for the covering physician on the weekend.
So I'd gotten into this kind of cycle. I had had half my liver removed because of the masses that were in it. And after that surgery, I developed a kind of tightness in one of the ducts, a small tube that drains bile from the liver. And so I'd gotten in this cycle of needing to have that duct expanded, dilated, and that was happening every 3-4 months. And each time they were opening it just slightly bigger, putting a stent in to keep it open. 3 months later, have the stent taken out, do it all over again. And it was miserable. It was one of the worst years of my life because I was just always recovering or about to have it again. And one day the covering physician came into my room. I'd never met him before, but he was immediately just present for whatever he found. I was not expecting anything. The covering physician usually just follows through the plan of care. And he had taken the time to go through everything and had a different idea that maybe doing less would be more, that maybe the next time we took the stent out, we should keep it out because the inflammation might be more of a problem than the tightening itself. And what he did was kind of not see me as just a collection of parts. He had put me into the context of my whole being and taken all of my different diagnoses together. And that shift in perspective is something that's harder and harder to do in medicine, where everything's so compressed for time and we're all sub-specialists that only know this one area. But he did it, and he was right. And he really gave me my life back.
And your surgeon.
I've had a few great surgeons, to be honest. And they are heroic people for a number of reasons. But my trauma surgeon has been there throughout. He was there the night of the first catastrophic hemorrhage, and he's literally like who I go to for primary care, basically, for my hernia surgeries. And like nothing phases him. He kind of regards the body as this thing that runs into trouble, and you fix it where you can and you don't judge it. Like, why would you do that? It's complicated. And his way of approaching it, is so genuinely just honoring in a different way than I think I know how to honor bodies. But it's a sacred relationship. I turn my body over to him. I go unconscious. He fixes what he can fix and he gives it back to me. And we're like, cool.
Rana, when did you realize you had a voice and when did you start using that voice?
This first illness experience really awakened the voice because so much of what I'd gone through was so familiar, I think, to patients. And I felt like I had a platform that I could speak about it, that maybe medicine would listen differently because it was a doctor saying it, because we so often devalue what we hear from not doctors, unfortunately. That was really almost a sense of obligation tied to my voice.
For the healthcare professionals, including doctors listening, what's one thing? What's one microskill, one small action behavior to be less biased towards people with healing disabled bodies?
I think not making assumptions that you know what someone else's experience is. We're conditioned to believe that we know what a valuable life is. I mean, certainly in the ICU, I've had moments where patients want to, usually it's families who want the patient to live on in what to me feels like a catatonic state with tubes and doesn't feel like a worthwhile life to me. I have no right to judge that. That is none of my business. So ceding some of that to the person whose life it is or the people who love them in small ways and big ways, whether it's in the clinic or in the ICU.
What's one thing we can do when the episode finishes, we turn off the YouTube, we turn off our headphones to work on our own embodiment?
I think cultivating a practice of attunement can start really small. It can feel like a big thing, but even just at the end of the day, like noticing the moment you felt the most alive, that you felt the most grounded, that you felt like you were bringing, the best parts of yourself to that moment. That's probably something you should build more of into your life. And we live in a culture that valorizes certain experiences and diminishes others. And I've often found that when I'm honest about truly my best moment, it's a very humble, like small interpersonal connection that wouldn't have met my radar if I hadn't asked the question.
Dr. Rana Awdish, thank you so much for joining me on the Visible Voices podcast.
Thank you for having me, my friend.
For people that do want to follow your journey, your writing, and more of your work,
my website is ranaaudishmd.com. I put my writings there. I have aspirations to put where I'll be appearing there. Whether or not that happens is a mystery. I'm on Blue Sky, Facebook, Instagram, and LinkedIn.
The Visible Voices podcast amplifies voices in the healthcare, equity, and innovation spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis MD on social media or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by hosts and guests are their own and do not reflect those of their employers or institutions. Guest appearances do not imply endorsement of any product, service, or organization. Information shared here is intended for general informational purposes only, reflects the time of recording, and should never substitute for clinical judgment or individualized medical advice. No physician-patient relationship is created by listening to or watching this podcast. Together, we're making healthcare more equitable, one visible voice at a time.